Good evening, everyone. I am Camille. I'm working at Uplifters as a learning designer, and I'm very happy to be here with you tonight. Welcome, everyone. We're going to slowly start this new episode of our series Uplift Your Night, which is actually the last episode of the series, and we will count to 33 episodes. So that's a great adventure that we lived together, and we're having some surprises for the community in the pipes that you will be aware of very soon. But at the moment, we're very happy to be with you tonight. I'm just going to give you a little bit of introduction about what Uplifters is for those of you who might not know us yet. So, Uplifters is a nonprofit based in Hong Kong. What we do is that we empower underprivileged communities with online education and peer support, and the signature online course that we provide is about money management, personal growth, and mental well being. And it is actually extremely easy to enroll. It is open to all domestic workers. The only thing you need to do is to go on our Facebook page and click send a message. So I really invite all of you to go and have a look and enroll in the course if you're not already one of our alumni. So, as I said, I'm delighted to be here with you tonight. This will be the last episode of a very long series where we had 33 different episodes on different topics, having our key partners as guests, with the idea to first and foremost be with you. Uplifters is a community, so it is very important to connect on a regular basis, but we also believe that a community is also when people want to be sharing knowledge with each other and learning from each other. So this is the number one reason why we created this series. And our episode for tonight is a topic that we've been discussing a little bit before, especially since COVID started. And we thought that it would be nice to end the series with an episode dedicated to mental health, and more specifically to actually the role that you as a domestic worker sometimes play when it comes to support emotionally your peers, and what it takes to do so, and the need to actually protect yourself and to safeguard your own mental health as you're supporting others. So I'm going to give a little bit of context, so we give a little bit of time for more people to connect and join us. And then I'll introduce our two guests for tonight. So, as a migrant domestic worker, homesickness, compounded with the need to adapt to a completely new environment, along with the financial pressures that you face, is definitely challenging. And we now know it all that COVID-19 actually just worsened the situation. So, for many of you, financial pressure have increased, your workload got heavier, and finding and keeping a job has become uncertain. So this situation is incredibly stressful. Mental health education and support are growing in Hong Kong and in Singapore, but, but most importantly, you belong to an extremely supportive community. And some of you are what we now call peer leaders, volunteering with charities and NGOs and other organizations to support further your fellow domestic workers. But it's not an easy thing to always know how to react when we are encountering people with difficulty, when we have friends in distress. And even if your peers don't openly share their difficulties with you, sometimes they may be showing signs of being depressed or anxious, even. And this may due to money concerns, working conditions, personal and families issues. There are as many reasons to feel bad as different people may feel bad sometimes. And even if it is by no means your responsibility to fix, and I think this is very important to start with that, you might sometime be asked for advice, or you might want to proactively provide your friends with some guidance and support, even if they're not asking it explicitly. So we hope that this episode helps you recognize signs of distress and also make wise decisions on the steps that you can take while you care for yourself. So this is really what we're going to be discussing tonight. As usual, and I see we have more people connecting. As usual, it is really appreciated when you just share your comments. Again, you are the one with the experience, and we're here to answer your question and just comment on your own experience. So good evening, Ellen Mae, and Nelly are already connected. It's very nice to see you here. And I'm gonna now tell you a little bit about OK Minds, the organization with who we partner on that very important topic to us, and about our two guests. And then I'll invite them to join me live so you can meet with them directly. So tonight we will be hosting Dr. Nimisha Vendam and Dr. Amit Wanshu. So together they co-founded OK Minds, which is an organization, social enterprise exactly, which is also based in Hong Kong, as Uplifters is, which main aim is to make mental health a priority for everyone. And so Nimisha, she is a former postdoctoral fellow from School of Public Health, the University of Hong Kong, and she has conducted research on the topics such as measuring and mitigating the impact of COVID-19 on migrant population, access to healthcare, and the need of cultural appropriateness in the health system. And now she's successfully translating her research knowledge into training and workshops. And I just want to thank them again, just because they're actually helping us to build our mentors' capacity when it comes to supporting their peers at the emotional level. So we're very closely partnering, and I know that their workshops are of great quality and of huge help for the community. Dr. Amit Wanshu, who is also delivering the training to our mentors. He has trained as a medical doctor, and today he wears many hats. He's the CEO of Space Communications, which is a first event management company of Jammu and Kashmir in India. He's also the director of Eaton Laboratories, which is the first pharmaceutical manufacturing unit of Kashmir, actively involved in low-cost healthcare, much needed. It has blended health and entertainment in healing and supporting people. And he has founded a trust in the name of his grandfather, Mr. Wanshu, which provides free ambulance service to the needy. So we have two persons who are deeply committed in supporting the health and the mental health, especially of marginalized groups. I'm just going to share their website with you so you can have a look. And I want to say how grateful we are for the time that they spend helping us, sharing the knowledge to the community. And we can now welcome Nimisha and Dr. Amit. Hi
Hi.
to the two of you. Welcome. How are you?
Thank
How
you
are you
for
doing?
yes, doing good. Thank you for inviting us today. It's a pleasure to be here with all of you.
You're very welcome, Nimisha. Thank you for your time. All
Thank you,
right.
Camille. Thank you so much for inviting us. It's really pleasure to be part of this program.
Thank you, Dr. Amit. So we have more people connecting. They're saying good evening. Now we always have some of our team leaders attending, so it's very important and very useful, especially tonight because it will be about also their role as emotional supporters of their friends. And before we dive into the topic, just wanted to share one comment that we have from Hélène Mae saying, there are many reasons to feel bad in situations that we are not expecting to happen. Yeah. How we are going to handle our feeling is not easy at all. So, yeah, it's all about emotions management, feelings regulation, however we call it. And we're going to dive a little bit more in detail into that. Thank you, Ellen May, for your comment. So now, the first question I'd like to ask the two of you is whether you could tell us what is the vision and what was the motivation behind funding OK Minds? Because I think it's always good to start with giving a little bit of context to the initiative that you're working on and supporting.
Thank you, Emily, for asking this question. So basically, what happened that Dr. Vanchu was here in Hong Kong in 2018. That time also we tried to conduct, and we conducted few workshops with the foreign domestic workers, and one was with the Filipino Nurse Association. So that time, Dr. Vanchu was not present in the workshop, but he guided and he collaborated that how best we can do that. Later when so after that he went back to India, and later when COVID came, then we thought of conducting it again, because all other physical means and face to face were all stopped, and only Zoom or any online platform were the only reason to communicate. And during that time started to getting calls from different migrant workers organization about their mental health condition, because it was some what we could find that many helpers, because of either because of their work condition, because workload suddenly started, and there were some very discouraging policies regarding social isolation, distancing, and also regarding the not giving holidays or day out. Those kind of things were there. Then we discussed, and we started to think how best to support them, and Zoom came out as the best meet. Then we started having those sessions with foreign domestic workers first, and gradually, with the word of mouth, it spread to other NGOs and other communities as well. So from there, it all started that how best our target during that time was how best you can protect yourself amid this pandemic, how best you can keep your mental health sound and healthy, and then how to prevent yourself from stress and anxiety during that time. So gradually from there we started, and now we are with the different NGOs, universities, and other underprivileged communities as well. We are working with them. So yeah, that's how we started.
Thank you,
And
Nimisha.
one of
And we're,
the interesting,
yeah, go
sorry,
ahead.
one of the interesting things that we had during this was that this word "okay" we found it because in Hong Kong, this is the only word which most of the people understand in English, and they would say like this, "Okay, okay." So, well, me and Amisha were sitting, so we thought the name has to be something which is understood by everyone and also goes with that your mental health, because unfortunately, most of the times we do care about our physical health, but we never care about our mental health. So that's where the word "okay" and "minds" was generated. And as Nimisha mentioned to you, that one of the major reasons was also that both of us have been working in the health sector with people who are marginalized or don't have those much of opportunities. And to be very honest, this started with this concept that how we can basically reach out to those people because they never ever care about mental health. And unfortunately, in such societies, mental health is also a stigma. So we need to talk about it.
Thank you. Thank you, Dr. Amit. I can't agree more. And having worked in different countries and within different societies, I can tell that, yeah, sometimes taboo are, again, very high, whatever the culture you're working in, living it is. So I think it's much needed work. So thanks a lot for that. And we are super happy to be one of the first partners with OKMine, and it was really useful. I can remember at the very beginning of the pandemic, and I'm very grateful that organizations such as OKMine are actually filling a service gap, because there was definitely a gap in that sense. Thank you for that. So now going a little bit deeper into the topic and into the question of um, what what are we talking about exactly? And when it comes to migrant domestic workers, what are the common mental health related issues or challenges that they usually face, according to you and your experience working with them?
Yes, so what we found that their challenges are not very different, but yeah, there are some peculiar difficulties they face. So, for example, let's take the example of stress. So, their reasons of stress are very different, and then what they feel can be little bit different. For example, they let's start with the loneliness, because they have to leave. Most of the MDWs, they need to leave their, say, small children, their partners, other family members, or even elderly persons. So they have to leave home and come back, come for their work. So one challenge is loneliness, and then it is again um, increased by their work condition, the place where they live, and the people where they live. So they sometimes they also feel their security issue, or they get in the uh, issues such as any kind of abuse, say physical abuse or sexual abuse. It's very easy for them to get into that trap. So I'm not saying everyone got this, but chances are high, and that also their own personal safety and security apart from their own living condition, because as you have already lived in Hong Kong, so you know how their living conditions are, what space they get to keep their stuff to for themselves. So then there is a some time issue, that what are their working hour, being them staying with their employer, it is difficult for them to get some me time or free time or free space. And with this pandemic 2 3 years, as work from home, and online study, those things also created a lot of impact on them not getting their own time and space. So yes, first thing is loneliness. Second thing is this overworked stress, or you can say some kind of burnout also started happening within them. Then there is anxiety. Anxiety issue is also very prevalent, because they are worrying about what will happen to my children, what will happen to my parents, what will happen to my partner, because apart from parents, because they are elderly or sick, or the children, how they are raising, how they are studying, those kind of things, the partner issue is also very troublesome for them, because sometimes there is cheating or betraying, or those kind of issues are there, that creates a lot of stress within them. Then there is guilt. Guilt is also a big thing among them, because they all being mother or being a sole breadwinner of the family, those are the situation with when they keep on feeling that they are not doing enough for the family, or they are not enough. So those things are there. One more very peculiar thing which I found, that paranoia is there within them, that they feel that it's uh, those kind of situation. I don't want to go in details, but I could see paranoia is there, which need to be taken care of, because sometimes when it is left untreated or undiagnosed or ignored, then it causes a lot of problem for their own health, and they very easily slip into the mode of or the ideation of killing themselves. So because we ignored all these issues, then the chances, because sometimes we get called that someone has just cut their wrist, or drank bleach, or jumped from the floor, so jumped from the window. So those are not very unusual thing, but that should not be there. But being a community member, being a supporter, whenever I get this call, this is very disturbing. But it's not that the no, maybe we don't hear such kind of news in the main media or anywhere, but I get calls, so that is disturbing for me. Then there is issue with sleep. Insomnia is also very prevalent among them, because I'm not sure, but I feel that during day they work and the night they spend their time either talking to their family members or spending time online. So that also creates a cause of insomnia or not fatigue or not feeling fresh during daytime.
Thank you, Nimisha. Is there anything you'd like to add, Dr. Ahmed, to this one?
I think that one of the things that you have to understand as far as their job is concerned and their job profile is concerned is that somewhere their mental clock is swinging like a pendulum between back home, all the things that they are basically fighting, and what they're doing at the workplace. So, because they have also come to work in order to support family back, and somewhere sometimes the employer starts misbehaving with them, or they have to do things which they don't want to do at that time, or the communication issue that wherein when the employer is basically talking, or when they are talking, sometimes just words, few English words, or somewhere they don't understand that particular thing, or the meaning is taken wrong, or maybe the employer understands a wrong way of things. And that is where the stress starts pointing out, and they don't have even many times a space wherein they can share that, because they can't go and share it back home, because they don't want to give stress to them, as they are already away and supporting them. And here also it's very few people with whom they feel that they can share. So we have to understand that they are the ones who are basically facing a 360-degree stress, and they have to tackle it all sides. And that's why sometimes we are all human beings, and we may unfortunately collapse or may not be able to fight back. But this is one of the things wherein we have to focus and give them that strength and tools, that how they can minimize these effects.
Yeah, thank you. It's very interesting, and it shows how concerning the situation is. And I really appreciate that you point out not only at specific challenges that they may face, but also what we could see as amplifier. I mean, like the fatigue, difficulties of sleeping is an issue in itself, but can also amplify other mental health issues. And same with the pressure coming from different stakeholders such as family and employers. So it's very well explained, how kind of trapped they sometimes find themselves.
I would like to add one thing here
Please.
that also I quite often hear from them is the issue of being exploited. So they feel that because if they are the only breadwinner of the family and they need to send money back home for children, for partner, or for parents, and once they don't get the thanks or gratefulness from the family, and they perceive it less, what they are doing for the family, it is not coming back in the form of care or gratefulness, that is hurting them again. So because we cannot ignore this thing also, because some of the participants also mentioned that they do everything for their family, but when they need, there is no one. So maybe children are busy with their education, parents are elder enough to help, and partner is not interested anymore. Those situations we cannot avoid. So they feel being exploited. So those kind of things must be very difficult for them to put them. Very easy to get into the trap of stress, anxiety, as well as depression. All
Yeah.
these are linked. Yeah, we cannot separate it out.
Yeah, thank you, Nimisha, for specifying it. I think like we all need some sort of recognition of our work, and I can only imagine when that work comes with that many sacrifices, the need for recognition might be even higher. But quite oppositely, they're in a situation where they don't get
Yes.
access to this form of recognition and value of their work, the value that they should deserve. Yeah, I very much agree with that. Thank you for sharing. I would like to ask now, talking about, how, as I said in my introduction, they're belonging to a very supportive community. Like we know because of some research that we did that Going to their peers is actually one of the first thing they'll do when they feel in distress before going to any um, specialized organization. So they're very supportive from each other. Now, it's not that easy for them to identify the signs of mental health issues, and especially depression and anxiety. So, yeah, sometimes it could help to know a little bit what to be mindful of, what to be looking at when we start to potentially identify symptoms.
Yeah. Dr. Vanju, you want to go ahead?
Oh, it's okay. So basically, as far as the basic symptoms are concerned, we have to always see first for the negative emotions. So, are they getting repeated, or is there a lot of presence of them? Are we seeing a massive change in them? And these negative emotions can be sometimes sudden anger, which is coming a lot, sudden kind of sadness, and which you are seeing repetitive times. Sometimes you're seeing a person into different mood changes, and sometimes you will see a social withdrawal, or a person is not at all interested in talking with people, wants to be in a lonely space, and wants to be somewhere away from everyone, is very irritable, or even has a lot of eating pattern changes, which you are noticing either is eating a lot or is not eating at all, or there are a lot of sleep pattern changes, and you're seeing that a person either is sleeping a lot or is not sleeping at all, or is sleeping at odd times. And these are very, very simple, basic things that you can observe. Sometimes a very irritable behavior, or a rebellious behavior, or a reckless behavior, that a person just wants to be, kind of has a rage or is very reactionary to you. And you can see, and these are some baseline symptoms. But when you see this rage in a more aggressive manner, and we can see the behavior is very aggressive, sometimes maybe starting with minor violent things, throwing something or just breaking something. So these are the situations when you have to take care of these things. And if this person is preoccupied with something like death, or is somewhere thinking of doing suicides or self harm or harming someone else, then definitely in those cases you have to consult a doctor. So the first one I said, there are these basic symptoms, and then the second phase wherein you have to be cautious, and the third phase wherein you have to basically go to the doctor. So whenever you see negative emotions and sudden change of negative emotions, repetition of negative emotions like anger, like sadness, going on a guilt trip, social withdrawal, memory loss, sometimes psychosocial vulnerability, and going on a guilt trip, being separate, living separately, hopelessness. So these things you have to keep in mind. Nimisha.
Yes, most of the signs and symptoms are these, which easily, if you are a little bit even mindful, you can understand that there is sudden change in the behavior or irritation or any such kind anger or rage are very common symptoms. But one more thing, being NDWs very closely knit and they spend on their holidays together. Mostly the Sundays they go out together and have fun, those kind of things. There you can, if you don't meet every day, then at least make notice change, because if you see one of your friend is very much interested in food or dancing or singing, and suddenly she changed her behavior. Suddenly she says that I don't want to, I am not interested in eating or going out or have fun or even dancing or singing. uh, then this is something like once in a while it's fine. But if it is a continuous, say for example 2 3 weekend you meet and she's showing the same symptoms, that are not interested. So the person who used to enjoy something and suddenly stopped having those enjoyment or activities or any interest, then that is again a very important symptom and easy symptoms to look for. uh, yes, mostly these are the things: eating, sleeping, and interest activities, and sadness. But any of the symptoms, if you can ask your friend or for yourself as well, that is this symptom extends for more than 2 weeks. So if it is for just say any event happened and you feel sad or you feel depressed or you feel anxious about something or you get angry, those are once in a while, no problem. But when it is the same behavior extending for more than 2 weeks, So 2 weeks is our keyword to look for. If someone is showing similar kind of, as Dr. Vanju mentioned about the negative emotions or abrupt behavior for more than 2 weeks, then that need to be taken care of and that needs some attention. Yes.
Thank you, Nimisha. I think it's very important to understand that it's not only about symptoms, but as you just said, like the duration of them, and also like how often they can be recognized. And also, like one thing I would add is really listen to your instinct and to your feelings, especially when it comes to your friends. So very often when we feel that something is not going right. Um, then we will just need to see it as a signal and as an indicator to potentially dig a little bit further and also one of the advice I'd like to share is, there is absolutely no harm in asking directly when you have
Yeah.
doubt, because sometimes we feel that if we speak about a situation, if we voice it out, that someone may not feel well, we'll just make it worse. But that's not happening. What's
Yeah.
happening when you ask someone about how they feel and just sharing, with them that you feel worried
Yeah.
about their situation, they will be more likely and they will be more comfortable sharing. So this is really
Yeah.
something easy that you could also try doing.
Yeah, and also these silence or anger or social withdrawal, those are all are signs that is crying for help. So see, if a person gets angry or showing abrupt behavior suddenly, what does it mean? It means some kind of attention, or it the person is seeking some kind of attention for, and the person is not able to help themselves, so that's why they need some attention. And when the person don't get it, then chances are higher that the person shut down or get the social isolated. So those things, just bear in mind that there are some more things underlying that, which we need to think about whenever we feel these situations.
Yeah, thank you, Nimisha. Now, when it comes to actually helping, we're not necessarily gonna go now into how to provide emotional support as such, because that would take too much time, at least for tonight. But like one thing we wanted to touch on a little bit was when you're supporting a friend, a family member, a peer. Emotionally it can also be draining for yourself, and the only way you can keep supporting that person is caring for yourself. But it's sometimes easier said than done. So one question I wanted to ask is, what are actually the risks for domestic workers when they support their peers in distress, and why they should care for themselves while they're offering support to others, and also how they should do that. So it's a big topic. We are not going to go too much into detail, but yeah, at least, helping the community to also have a little bit of a wake up call about how important it is to care for oneself.
Dr. Vanji, you want to go ahead?
So, I think first and the foremost thing that they all have to think is that whenever anything like this they feel or it happens to them, it's a time to take a break. And this break can be one from your what we call basically as the counseling the counselor. You know, if you are the one who's basically doing the role of a counselor or counseling your peers or friends or people who are around you, there's every chance, even doctors also feel sometimes that they are emotionally drained, because at the end of the day, we are all human beings. So the best thing that time is to take a break, maybe a holiday you can take from your job, or you can take a break for some days, or you can move out, go on some vacation, so that first your mood starts getting slightly better. Second thing, what I have seen in many cases of the domestic workers is also that they are very much attached to their children, or they are very much attached to their family, or maybe parents, or maybe siblings. There's always a person, one or two, with whom they are very much attached. So whenever you basically feel a lot of pressure on your own self, so there is a important thing that you need to download as well. So always have during those durations a person with whom in the evening you chat or you talk on phone, or if it's possible to meet that person, you meet face to face for a cup of coffee or sometimes maybe for a lunch on Saturday or Sunday, and just whatever you feel in, express, because that will give a lot of vent to the things that are basically settled. Because what happens is that when we listen to human stories, we also get emotionally drained, and once, twice, thrice you can filter, but sometimes it also goes in and deeply touches us. Another thing is that you should always indulge yourself in some good, nice, creative thing whenever anything like this is happening. It can be music, it can be laughter, it can be having good time with your friends, it can be doing a short video, whatever you like. Basically, that's very important. And also some nice breathing exercises if it is like going too much on you in the mornings or in the evenings, wherein it gives you a lot of stress relaxation time. And especially when you are going into such sessions or such people are interacting with you, before that session and after that session, you should always give a momentary break to your own self with positive things, so that you are charged when you are going into the session, and after you are drained, you again do those few things which basically charge you. Dr. Nimish.
Yes, I just wanted to add one thing, that this phenomena is known as compassion fatigue, or this is also known as vicarious trauma. So, what happened that when you are in this caring or helping role, as Dr. Vantu mentioned about the doctors or any healthcare professionals, as well as social workers or nurses or anyone who is whose role is taking care of others. It can be the family members or the any caregiver in the family. Whoever is taking care of others, what that person feels is the emotion of others. So it is like the person who are in this role, they have their empathy very high, so they can feel others pain or the emotions what others are doing. Likewise, the peer leaders, when they are listening to the story of other community members, they feel the same emotion, they feel the same pain. So one thing what they can do, try to make a distance between the story of others and their own emotion. I'm not saying don't be empathetic, but too far, taking empathy too far is a quite dangerous thing. So you just take a step back and you make sure that this is not your story. The pain you are not going through. What at the as the peer leader, what you need to do is to understand what the other person went through. It is not needed that you go through the same pain. It is never needed. So make this distance from the story you are listening and from yourself and your emotions. Be empathetic, but keep that empathy in control. And as Dr. Vanchu mentioned, the first thing is important that you take care of yourself. If you are not able to handle your emotions, because this will be like compassion fatigue or trauma, you will start feeling the same thing, same irritability, same sensitivity, same pain, same fatigue, and then you won't be in a position to help others, because you will be vulnerable. You need someone to take care of yourself. So, yeah, very good thing is that you take break from there. First thing, at the first, you do prevention. Do make a distance from your emotion and the story. Second thing, take a break. Third thing, you keep yourself like, you cannot pour water from your empty glass. So you need to fill your glass. One way, like you talk to others. Other way, you can do some meditation or some yoga or some pursuing some habits, some what hobbies which you like enjoy, watching movie, going out, having fun, and just don't indulge yourself in the same story. Keep on thinking, just change that whole thing whatever you heard from someone. So those kind of things you can do to protect yourself. Yeah, there are many things, but I think taking a break from the situation and making a distance is something you can always do. Yeah, one more thing I would like to say, that take out 10 minutes from your 24 hours, and that will not be for others, only for you. Just 10 minutes before the bed, when you sit on the bed for sleeping, then you can sit and just keep this 10 minutes not to think about whether my kids eaten or not, or what happened to my husband or my daughters or my mother, father. No, it's about you. Just take that 10 minutes and develop self compassion. Have some compassion for yourself, because this world happen when you open your eyes. When you don't open your eyes, this world will not happen for you. So whatever you are doing, just give 10 minutes to yourself before bed. Yeah, those are a few things which anyone can try.
Thank you, Nimisha. I really like that we're ending this part with the concept of self-compassion, which is not that easy to actually grasp.
Yes,
It's really something that you start feeling when you gave yourself a chance to experience it, which sometimes takes a little bit of time. I'm a little bit mindful of the time, and I also want to give you an opportunity to explain what your vision is and what you think we could do more for the community in Hong Kong. But I just wanted to say to add, when you feel this need to take a break and that you're actually taking the break, don't see it as giving up or not considering anymore the person that you started helping, but also consider, and that's something that you should potentially doing also at the very beginning of your support, referring the person um, to professional support. Keep in mind that however how you could be the best friend ever, you could be very good at supporting your friends mentally, you're not a psychologist, and depending on the mental health issues that the person faces, she or he might need to go and seek for professional help. And that's the case for any kind of challenges. We're talking about mental health, but if there is, an issue with on the legal side of things with an employer, for instance, then it will be more useful for the person to be referred to an organization such as Help for Domestic Workers, for
yes,
instance. But referring is not always an easy thing. You need to access the knowledge. You need to know who in Hong Kong or in Singapore you can refer your friend to, and so that's why we and other organizations too tried to put together information to give you access to where you could refer your friends to. So I'll just stop here. To me, it's very important to keep in mind that referring friends to others is actually helping, is a direct help you can bring. I'll share the link to what we call our community directory in the comments. While I give you more time, Dr. Amit and Dr. Nimisha, to maybe share with us what are your future initiatives to improve the mental health of migrant domestic workers in Hong Kong. Is there anything you have that you want to be sharing now?
Dr. Vanju, you want to go ahead?
See, I have always established that this is one of my favorite people with whom I want to work, and I want to see them always mentally very fit and sound, and their mental health immunity should be the best, because I know that they also face lots of challenges and still they are very strong. So we have been, like me and Nimisha have been working with various organizations in Hong Kong also, wherein we plan to integrate few programs and launch few programs with universities wherein this kind of element is also there, and then the ethnic minority element is also there, because these are the communities wherein they do face lots of stuff. And I want to work one basic area is that me and Namisha were discussing through OK Minds is the communication skills, because that's one of the things wherein they face lots of problems. And if we are able to sort out that thing to some extent, many things in their communication with their employers or being in the foreign land, that will come down. Second is their normal health status, because in Hong Kong also they do face sometimes troubles when you have to wait for like long term in general checkups, hospitals, testing, and things like that, wherein we through these OK Minds can be of some help by generating this awareness that how you need to have the medical experts in in those hospitals or places wherein they can understand what exactly they are feeling, what exactly is needed, what exactly is required. And third, definitely guiding them wherever through OK Minds will be trying our best as far as their future course of action, their future course of career is concerned. Because one very good thing I find in all of them is that they have lots of aims and ambitions for their life in spite of facing many challenges as well. And that is the sign of a very healthy, strong human being. And that's where we also would love to work through OK Minds. Nimisha.
Yeah. Yes. So, as Dr. Vanju mentioned about the communication, yeah, we are working on that. Apart from emotional first aider training, because we are going to elaborate this training for now it is 8 hour, but we are planning to include few more flavors into it, and it will be 10 hours. So that will enable someone to give a very preliminary counseling. The counseling, I'm not labeling it as a counseling, but I am labeling it as someone who will be having some basic professional understanding how what to do, what not to do, do's and don'ts, those kind of thing, even in the crisis situation. For example, if someone is going to kill themselves, then those kind of crisis situation, how best in that panic period someone can help. So we want to include that as a separate section also in our course, dedicated especially for the crisis management and how best you can communicate during that period. Apart from that, there is two things we are going to add. One is the cultural appropriateness. So that is again part of my research as well. So I want to include those portion also, that because most of the migrant domestic workers employers are of different culture. So how best they can learn some cultural competency to handle their employers, and the conflict, less and less conflict will happen because of that. One more announcement is there that we are at OK Minds also providing counseling services. So we have a few counselors who can be available like you need to book an appointment through us, and they can help you in case anyone need. Then please do contact us. So these are the three things which we are working on. Thank you.
Thank you, Nimisha. They're very concrete, and I'm very amazed by the scope of your work, and I think it's all very complementary. I really like it that you're about to work more on communication, which is extremely key to this specific community for sure. Well, we're coming to an end very slowly. I'm mindful of the time being now late in Hong Kong and in Singapore. So I wanted to say again how grateful we are to have you on our side to help build these capacities so team leaders can better support their fellow domestic workers while caring for themselves, which is absolutely key, and also for this very specific episode. And I really hope it was useful for the community, and I'm sure a lot of information got heard tonight. Usually, we finish the episode with a little bit of a ritual that we have, which is also helping with mental health issues sometimes. Sharing because we are free tonight, we're just going to be sharing one. This is something that the community is very used to. It is part of our course, Dare to Dream. So we share the one little thing that matters happy that day or like the past week, just because it makes us happy to share. And also, it was proven that listening at others' little joys also help you make feel happy. So who want to start sharing what made them happy the past day?
Okay, I will start. So yeah, what made me happy today? Yeah, it was raining today, drizzling, not raining, and my kids were in the balcony. They were dancing in the rain, so I joined them. So that gave me a lot of pleasure. Yeah.
Thank you,
So
Misha.
yeah.
That's lovely. That's lovely. Thanks. That's a very simple thing to witness. Thank you for sharing. Dr. Amit?
So I today was basically going on the lakeside for a walk, and we have a very special boat, what we call shikara in Kashmir. And in the evenings, as it's now just the autumn is touching, and it's very beautiful view. And then I met this very small little kid, around 6 7 years old, and so she's telling me that, oh, you're wearing a very good coat. So because I mostly don't dress too formally, so it was just today that I had to attend one session, so I dressed formally. I said, so what is this? What is the special thing in this coat? So she's like, I like the color, and I also like your hairstyle. And then she told me, like, she was so confident that she's telling me, so what is your name? I said, okay, my name is Amit, and what are you doing? So I said, I'm a doctor. So where is your another ear? You are not carrying that. So that was when I had a laugh, like the stethoscope that she was talking. I said, no, no, right now I am not going to any hospital. No, you should carry always. You don't know whenever anyone can fall sick. I said, okay, I will do that from now
Cute.
on. So that
Oh,
was
what a
very
nice,
recent
yeah,
moment.
what a nice encounter. I love it. Thank you for sharing.
Thank, thank you.
It's funny because I think mine is also related to children. So it looks like there was something in the air the past days. It was like I realized over the weekend that I was feeling a little tired, maybe a little down because of a lot of work and just life. And I realized how grounded I was when my kids are around, just because you need to be fully present. And so I'm very grateful to have them around because they sometimes just give you any choice. You need to forget what's actually happening in your mind to just connect with the present moment. So I was very grateful to have this possibility of doing it,
Yeah,
obligation of doing it.
Great.
that's true.
All right.
That's nice.
Well, thank you again. It was a lovely last episode. It really means a lot to me to be ending this series with such an important topic, which is very important for uplifters, but which is also really close to my heart personally. So thank you again. And we'll see you again, the community, very soon. We're going to come back with a different format where you'll learn more very soon. And I just want to wish everyone good night and please take care.
Yeah, and
Thank
one thing I
you.
would like to add here, Camille, is that we salute you and uplifters for the kind of work that you are doing. And I personally, as well as Nimisha, we keep on sometimes talking about like what wonderful work uplifters is involved in, and the kind of personal touch you give to everything. It needs a lot of commitment in today's world when we are not even taking care of our own respective families, leave aside the extended family. But you have given it all a shape of a family, and I really, even on behalf of OK Minds and Nimisha, salute you and uplifters. All the best.
Thank you. Thank you. It means a lot. Thanks a lot. Very kind words, and I'm really taking it both for
Thank you.
me and for the organization. Thank you, Dr. Amit.
Thank you.
All right. Bye bye, everyone. Take care and have a sweet
Bye.
week.
See you.
Bye.
Okay.
Bye bye. Take care.
Bye.
Bye. Thank
Bye.
you, Kamali, and everyone
Thank
for
you.
joining us today. Bye.